For somebody that is metabolically unhealthy, new to fasting, how do they begin that practice?
Fasting is a lot easier than many people recognize because as you begin to fast, you exhaust your carb reserves fairly soon. And as you exhaust your carb reserves, these people already have high glucagon levels, they are insulin resistant, they are starting to do gluconeogenesis in the beginning. In other words, they are making glucose from fat and protein. They're also using up the stored glycogen in their liver and in their muscles. And as you fast, you start burning fatty acids in the muscles, you start making ketones in your liver. And fasting becomes a lot easier the more you practice it. So I would initially advise that, hey, try 12 hours and then kind of over a period of a few weeks. Some people can do it in a few days. Go up by an hour every day until you are reaching a point of about, let's say, 18 to 20 hours of fasting if you are metabolically unhealthy. I also think that people who come at a level which I would describe as a body mass index of 35, 30 to 35, severely insulin resistant, which means that their insulin levels are high. And in the presence of high insulin levels, they also have high glucagon levels, which means that insulin and glucagon are not talking to each other. Because remember, as the insulin level goes up, the glucagon should go down. They also have high A1C despite having high insulin. These people might benefit from a supervised 3 to 5 day fast. And when I say supervised, the reason it should be supervised is because fasting creates all kinds of changes in the body. And we can get into that as to what are some of the reasons why you need to be monitored. Your electrolytes may change, the levels of your cortisol may increase, the level of your epinephrine and norepinephrine, these are the fight or flight hormones, they may go up. So long term fasting in my mind should be definitely supervised. Short term fasting, like 18 to 20 hours every day, so in other words, 2 meals or 1 meal a day, can perhaps be more easily accomplished without the degree of stringent supervision that would otherwise be necessary. And when you're fasting, many people think there's a group of people who think that fasting is very bad for you because of several reasons. One is that you are losing muscle mass, you're losing protein. That's one reason why people don't want you to fast. Number two, there is an increased risk of heart rhythm problems. You may get atrial fibrillation, you may get palpitations and stuff like that. The number three reason why people say don't do fasting is because it slows down your metabolism. And that's very important. You don't want to slow down your metabolism, you don't want to lose muscle mass, and you don't want to get palpitations. So let's take each one of these. As far as protein mass is concerned, I'm very happy to report that our body is so smart. And one of the reasons we age is because our protein gets senescent. In other words, protein becomes old, misfolded, malfunctioning. One of the reasons we get dementia is because there is protein in our brain that we have not bothered to clear up. And fasting promotes autophagy. It's going to get rid of junk protein first. It's going to help your brain because you're getting rid of junk protein. It's going to help your muscles because you're going to get rid of junk protein. There are studies after studies that show that fasting creates a spike in your growth hormone. Growth hormone is one of the anabolic hormones. So when refeeding starts, the high levels of growth hormone will let you deposit new protein. So I think that muscle mass loss should be put aside with this, at least with a traditional form of fasting. I'm not talking about losing muscle mass, which you will if you're insulin resistant, and your insulin resistance is being treated with many of the drugs that would accelerate your protein loss, like SGLT2 inhibitors. We can get into that later if you want. Number two aspect is arrhythmias, and that is true because when you're fasting, your cortisol levels are going up. Why does cortisol go up? Because the body has to make glucose. And in order to make glucose, it's going to increase hormones that promote gluconeogenesis. So cortisol is one of the mechanisms through which you make new glucose. The levels of your fight or flight hormones, in other words, initial studies, seminal studies done in the 50s, 60s, and 70s have shown that the levels of the fight or flight hormone, which is epinephrine, norepinephrine, other names for that is adrenaline and noradrenaline, they go up. The urinary metabolites of these hormones go up. And these hormones have gone up to make sure that you have enough glucose to feed your brain in case of an emergency. So these are gluconeogenic hormones. But they also stimulate the heart and can cause heart rhythm problems or palpitations. So you are at a slightly higher risk of arrhythmias. And so that's something that you may want your doctor to monitor to see how much you are at risk and how fasting can be individualized. The third aspect is the slowing of your metabolism. And I would agree that metabolism definitely slows down with long term fasting. It has been shown. However, you can prevent the slowing of your metabolism by doing what I call as zone 2 exercise. So the question becomes is what is zone 2 exercise? Zone 2 exercise is exercise in which you are stressing your system, your cardiac system, to the point that you're using only fat as fuel, fat as energy fuel. If the exercise gets to higher intensity, you get out of zone 2. Your body is not just consuming fat, but it also needs to burn carbs. So what is the body going to do if you go into zone 3, 4, 5, and 6 is that it's going to jack up your cortisol levels. It's going to jack up your epinephrine and norepinephrine levels in order to make more glucose through gluconeogenesis, which is going to accelerate your protein loss. So in order to avoid that, if you exercise at a heart rate which is roughly, this is perhaps the best parameter that Phil Maffetone talked about, which is 180 minus age. So if you're 60 years of age, exercise at a heart rate that is less than 120. Another way to find that out is that you're exercising, but you can have a conversation with your friend without having to pause for breath. So that's conversational pace exercise. So with these three techniques, you can make your fasting safer.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Phytosterol levels are significantly increased in people who are taking a statin. And this phytosterol is causing damage and harm that has not been properly investigated. With regards to the canola oil,